Cna Practice Test App. Question 1. The nurse aide is caring for a resident with a urinary catheter who has not had any urine output in the past 2 hours. What should the aide do first? Option A. Increase the resident's fluid intake. Option B. Milk the tubing to check for obstruction. Option C. Check for kinks in the tubing and ensure the bag is below bladder level. Option D. Irrigate the catheter with sterile saline. The correct answer is option C. Check for kinks in the tubing and ensure the bag is below bladder level. The first step is to check for simple mechanical issues: kink tubing, the resident lying on the tubing, or the drainage bag positioned above bladder level, preventing gravity drainage. Never irrigate a catheter without an order. Question 2. The nurse is caring for a new mother who asks why her baby has lost weight since birth. The best explanation is: Option A. The baby is dehydrated due to polyuria. Option B. The baby is hypoglycemic due to lack of glucose. Option C. The baby is allergic to the formula. Option D. The baby can lose up to 10% of weight due to meconium stool, loss of extracellular fluid, and initiation of breastfeeding. The correct answer is option D. The baby can lose up to 10% of weight due to meconium stool, loss of extracellular fluid, and initiation of breastfeeding. Newborns normally lose 5 to 10% of birth weight in the first few days due to meconium passage, loss of extracellular fluid, and establishing feeding. This weight loss is expected and not pathological. Question 3. When taking a resident's blood pressure, the nurse aide hears the first sound at 130 mmHg and the last sound at 80 mmHg. How should this be recorded? Option A. 130/80. Option B. 80/130. Option C. 130/50. Option D. 80/50. The correct answer is option A. 130/80. Blood pressure is recorded as systolic over diastolic. The first sound heard, Korotkov phase I, is systolic pressure. The last sound heard, Korotkov phase V, is diastolic pressure. 130/80 mmHg is within normal range for many adults. Question 4. A client is likely to tolerate higher pain due to: Option A. Being a 55-year-old woman with moderate low back pain for 3 months. Option B. Being a 30-year-old man with first-time appendicitis. Option C. Being a 50-year-old woman with a new migraine. Option D. Being a 20-year-old athlete with an ankle sprain. The correct answer is option A. Being a 55-year-old woman with moderate low back pain for 3 months. Previous experience with pain and successful management increases pain tolerance. Chronic pain sufferers often have higher tolerance than those experiencing acute, first-time pain. Question 5. Which intervention should the practical nurse implement to help a client cope effectively with chronic pain? Option A. Administer around-the-clock opiate drugs. Option B. Give scheduled doses of benzodiazepines. Option C. Recommend avoiding painful activities. Option D. Encourage using relaxation techniques. The correct answer is option D. Encourage using relaxation techniques. Non-pharmacologic interventions like relaxation techniques, distraction, and guided imagery help clients manage chronic pain and reduce reliance on medication. Avoiding activities leads to deconditioning, not improved coping. Question 6. Which position is best for the nurse to place the client during administration of a rectal suppository for constipation? Option A. Prone with pillows under the abdomen. Option B. Supine with the client on a bedpan. Option C. Left sims with the upper leg flexed. Option D. Right side lying, knee chest position. The correct answer is option C. Left sims with the upper leg flexed. Left sims position, left side lying with right knee flexed, allows the suppository to be inserted along the natural curve of the rectum and promotes retention by gravity, as the sigmoid colon is on the left side. Question 7. The nurse is assisting a client with diverticulosis to select appropriate foods. Which food should be avoided? Option A. Bran. Option B. Fresh peaches. Option C. Cucumber salad. Option D. Yeast rolls. The correct answer is option C. Cucumber salad. Clients with diverticulosis should avoid foods with seeds or small particles that can become lodged in diverticula, including cucumbers, seeds, strawberries, raspberries, and popcorn. Question 8. Which lab test best reflects a client's long-term protein status? Option A, serum albumin. Option B, prealbumin. Option C, BUN. Option D, creatinine. The correct answer is option A, serum albumin. Albumin has a long half-life, 20 days, and reflects long-term protein status. Prealbumin has a shorter half-life, 2 to 3 days, and reflects more recent protein intake. BUN and creatinine assess kidney function. Question 9. When measuring the height of a resident who cannot stand, the nurse aide should: Option A, estimate the height based on arm span. Option B, use a tape measure to measure from head to heel while lying flat. Option C, ask the family how tall the resident used to be. Option D, skip height measurement as it is not important. The correct answer is option B, use a tape measure to measure from head to heel while lying flat. Recumbent height, lying down, can be measured using a tape measure from the top of the head to the heels with the resident lying flat. Arm span can also be used as an estimate. Height is important for nutrition assessments and medication dosing. Question 10. A resident has a doctor's order for UP with help of 1 UWH1. What does this mean? Option A, the resident is independent with mobility. Option B, the resident requires the assistance of one person to get up. Option C, the resident is bedridden and cannot get up. Option D, the resident needs a mechanical lift for transfers. The correct answer is option B, the resident requires the assistance of one person to get up. UWH1 is an abbreviation meaning the resident requires the assistance of one person to get up from bed or a chair. This is a transfer assistance level. The aide should follow the care plan and use proper body mechanics. Question 11. Which of the following is the most important reason for reporting changes in a resident's condition to the nurse? Option A, to document the change in the aide's daily notes. Option B, to protect the facility from liability. Option C, to prevent deterioration and provide timely intervention. Option D, to demonstrate that the aide is performing their duties. The correct answer is option C, to prevent deterioration and provide timely intervention. Early detection and reporting of changes, skin breakdown, behavior changes, decreased appetite, allows for rapid intervention and prevents further deterioration. Resident safety and well-being is the highest priority. Question 12. When providing foot care to a resident with diabetes, the nurse aide should not: Option A, dry thoroughly between the toes. Option B, report any redness or open sores. Option C, soak the feet in warm water. Option D, apply lotion to dry areas, avoiding between toes. The correct answer is option C, soak the feet in warm water. Diabetic residents should not soak their feet because soaking can dry out skin, increase infection risk, and lead to skin breakdown. Feet should be washed gently with mild soap and warm water, then dried thoroughly. Question 13. The nurse aide is assisting a resident who is recovering from hip replacement surgery. Which position should be avoided to prevent dislocation? Option A, lying on the non-operative side with a pillow between the knees. Option B, sitting in a low, soft chair. Option C, lying supine with the legs straight. Option D, sitting in a firm, high chair with arms. The correct answer is option B, sitting in a low, soft chair. Low, soft chairs cause the hip to flex beyond 90 degrees, increasing the risk of dislocation. Residents post-hip replacement should sit in firm, high chairs with arms to maintain proper positioning. Question 14. When transferring a resident from a bed to a wheelchair, where should the nurse aide position the wheelchair? Option A, on the resident's strong side, locked under a 45-degree angle. Option B, directly facing the bed, locked, with footrests removed. Option C, on the resident's weak side, unlocked for easy movement. Option D, at the foot of the bed, facing away from the resident. The correct answer is option A, on the resident's strong side, locked under a 45-degree angle. The wheelchair should be placed on the resident's strong side at a 45-degree angle to the bed. The brakes must be locked and footrests moved out of the way. This position allows the resident to pivot toward the chair using their stronger side. Question 15. The nurse aide sees another aide hitting a resident. What should the aide do? Option A. Report the incident to the charge nurse immediately. Option B. Mind their own business to avoid conflict. Option C. Confront the other aide in the hallway. Option D. Tell the resident to report it themselves. The correct answer is option A. Report the incident to the charge nurse immediately. Witnessing abuse is a mandatory reporting obligation. The aide must report the incident immediately to the charge nurse or supervisor. Failure to report is a violation of law and professional ethics. Resident abuse can result in criminal charges and license revocation. Question 16. The nurse is performing discharge teaching on a client with diverticulitis who has been placed on a low roughage diet. Which food would have to be eliminated? Option of roasted chicken. Option B, noodles. Option C, cooked broccoli. Option D, custard. The correct answer is option C, cooked broccoli. Cooked broccoli is a high-fiber, roughage, food that should be avoided on a low roughage diet. Roughage foods increase bowel motility and can exacerbate diverticulitis symptoms. Question 17. An older adult client admitted with dehydration and electrolyte imbalance is confused and incontinent of urine. Which strategy provides the best intervention for incontinence? Option A. Insert an indwelling urinary catheter. Option B. Apply absorbent incontinence pads. Option C. Restrict fluids after the evening meal. Option D. Establish a 2-hour voiding schedule. The correct answer is option D. Establish a 2-hour voiding schedule. A scheduled voiding program, every 2 hours, promotes continence by establishing a routine and minimizing accidents. Catheters increase infection risk. Fluid restriction is inappropriate for a dehydrated client. Question 18. A 24-year-old female client is scheduled for surgery in the morning. Which is the primary responsibility of the nurse? Option A. Taking the vital signs. Option B. Obtaining the permit. Option C. Explaining the procedure. Option D. Checking the lab work. The correct answer is option A. Taking the vital signs. The nurse's primary responsibility is taking preoperative vital signs to establish a baseline and identify abnormalities that may require surgery postponement. Obtaining the permit and explaining the procedure are the physician's responsibility. Question 19. A client's indwelling urinary catheter is removed at 9:30 a.m. The nurse assesses the client every 2 hours for the desire to void. Which documented assessment requires further intervention? Option A. 1:30 p.m. unable to void. Option B. 5:30 p.m. unable to void. Option C. 3:30 p.m. unable to void. Option D. 11:30 a.m. unable to void. The correct answer is option B. 5:30 p.m. unable to void. After catheter removal, the client should void within 6 to 8 hours. By 5:30 p.m., 8 hours post-removal, without voiding, the client is at risk for urinary retention requiring intervention such as bladder scan or straight catheterization. Question 20. A resident is on NPO status. What does this mean for the nurse aide? Option A. The resident can have water but no solid food. Option B. The resident can have ice chips only. Option C. The resident cannot have anything by mouth, no food or fluids. Option D. The resident is on a pure diet only. The correct answer is option C. The resident cannot have anything by mouth, no food or fluids. NPO stands for nil per os, Latin for nothing by mouth. The resident cannot eat, drink, or receive oral medications. This is common before surgery or certain procedures. The aide should ensure no food or fluids are provided without a direct order to resume. Question 21. The nurse aide is collecting a urine specimen from a resident who has an indwelling catheter. Where should the specimen be obtained from? Option A. The drainage bag at the bottom. Option B. The catheter tubing using a sterile syringe. Option C. The bedside container used for emptying the bag. Option D. The collection port on the drainage tubing. The correct answer is option D. The collection port on the drainage tubing. Urine specimens should be obtained from the collection port on the drainage tubing using a sterile syringe, after clamping the tubing below the port. Never collect from the drainage bag, as urine may be old or contaminated. Question 22. A resident is on oxygen therapy via nasal cannula. The nurse aide notices that the tubing has become disconnected. What should the aide do first? Option A. Reconnect the tubing and check the flow rate. Option B. Turn off the oxygen completely. Option C. Remove the cannula from the resident's face. Option D. Call the nurse to fix the problem. The correct answer is option A. Reconnect the tubing and check the flow rate. Oxygen is a prescribed medication. The aide should immediately reconnect the tubing and verify the flow rate is at the prescribed level. Delaying action could cause hypoxia. The aide should then report the incident to the nurse. Question 23. The nurse aide is caring for a resident who is on strict intake and output (I&O) measurement. Which of the following should be counted as intake? Option A. Ice chips, documented as half the volume. Option B. Solid foods at mealtime. Option C. Vomitus. Option D. Urine output. The correct answer is option A. Ice chips, documented as half the volume. Ice chips are counted as intake, typically recorded as half the volume. For example, 120 ml of ice chips equals 60 ml intake. Solid foods are not measured as liquid intake. Vomitus and urine are output, not intake. Question 24. A resident with a history of falls is getting out of bed without assistance. What should the nurse aide do first? Option A. Apply a vest restraint to prevent further attempts. Option B. Remind the resident to call for help and offer assistance. Option C. Report the incident to the charge nurse immediately. Option D. Lower all 4 side rails to prevent injury from climbing over. The correct answer is option B. Remind the resident to call for help and offer assistance. The least restrictive intervention should be attempted first. Reminding the resident to call for help and offering assistance respects the resident's rights while promoting safety. Restraints require a doctor's order and are a last resort. Question 25. For an immobile client, which nursing diagnosis has the highest priority? Option A. Impaired gas exchange. Option B. Risk for impaired skin integrity. Option C. Risk for constipation. Option D. Activity intolerance. The correct answer is option A. Impaired gas exchange. Airway and breathing always take priority over other concerns. Impaired gas exchange can rapidly lead to death, while other diagnoses represent potential or less immediate threats. Maslow's hierarchy and ABCs, airway, breathing, circulation, guide this prioritization.